It's fabricated. The mastermind behind this mirage is an organization called the World Professional Association for Transgender Health, or WPATH. First of all, don't be fooled by the group's carefully crafted facade. WPATH is not a scientific organization. It's an activist group masquerading as a professional medical association. And here's how they manufactured the consensus. Stay with me, it gets a bit complicated. In 2001, WPATH produced standards of care recommending puberty suppression, despite the scientific literature at the time consisting of one single case study. In 2009, WPATH members on the inside of the Endocrine Society produced guidelines recommending this protocol, also based on exceptionally thin evidence. Then in 2012, WPATH produced another set of standards, recommending the unproven treatment, citing the Endocrine 2009, which was based on their own shoddy 2001 document. It's clever, isn't it? But then something remarkable happened. Major medical associations across the globe copied WPATH's 2012 guidelines, trusting that WPATH were the experts, trusting that the protocol was evidence-based, unwittingly endorsing an experiment on healthy kids that lacked any credible scientific support. That is how the so-called consensus was built. In fact, the UK's CAS review that revealed this tangled web of circular citations rated WPATH's guidelines and all based upon them as lacking scientific rigor. Another similar review rated them unanimously as do not recommend. But my personal favorite is a Belgian expert who, when asked why his institution had not formally evaluated WPATH standards of care, replied, "If we had to review them, we'd actually toss them in the bin. That's precisely where they belong." So there you have it, Brandolini's law. It takes an order of magnitude more energy to refute misinformation than it does to produce it. And that was just a taste of what we're up against. The truth is, for the last decade, our governments, both federal and provincial, with the exception of Alberta, have taken the easy option, blindly accepting these activist slogans as fact, while choosing to ignore that nation after nation is abandoning this reckless experiment. By doing so, they have firmly secured their place in history as the leaders who looked the other way as innocent youth fell victim to one of the greatest medical crimes in history.